This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together.
This video will be presented in 3 sections. Section 1, Introduction. Section 2, How will I start home infusion therapy? Section 3, What will I do if I have a problem or questions about my home infusion therapy? Your doctor has recommended that you receive medications, fluids, or nutrition through your IV or intravenous catheter at home. Certain medications, fluids, and nutrition or TPN can be delivered safely through IVs at home with home infusion therapy. Home infusion therapy starts when you are getting ready to leave the hospital. Nurses and the infusion pharmacy work with your medical team in the hospital to plan your transition home. Home care and home infusion staff tailor your plan based on your medications, fluids, or IV nutrition, the dosing schedule, and other factors. Once you get home, typically, patients and their caregivers are taught to perform the day-to-day IV catheter care, and very frequently the infusions as well. This is safe. The home health or home infusion nurses will teach you what to do. It is important that you pay close attention to the nurse's instructions to reduce the risk of rare complications, such as IV line-related infections and clots. Now we will talk about how will I start home infusion therapy. Number 1. Your first visit may happen during your hospitalization. Sometimes a home care infusion RN will perform a bedside teach with you while you are still hospitalized to prepare you for your transition to home care. Number 2. Your first visit at home happens soon after your arrival home. The home infusion pharmacy will send you medication, fluids, or IV nutrition to you. The nurse will come to your home. This first visit is often the longest visit, sometimes 2 hours or longer. It might be a good idea to have caregivers who may be helping you with your infusions be present at this visit as well. Number 3. Your nurse will teach you and your caregivers how to deliver the medication, fluids, or IV nutrition. The goal is to make you as independent in your care as possible. Delivering the medications, fluids, and IV nutrition is not difficult, and the team will be with you through every step. Number 4. Your nurse will help you understand your medications, fluids, and IV nutrition, and the basics of infusion therapy. Your nurse will also teach you how to store your medication, including how to keep medicine from children and pets. Your nurse will review medication side effects with you and what to do if you experience any. Number 5. After this visit, the infusion pharmacy will deliver your medications, fluids, and IV nutrition at least once a week. Your nurse will also visit once a week. During your visits, your nurse examines you, asks about symptoms, changes your IV line dressing as needed, and draws bloods for labs as needed. What to do if I have a problem or questions about my home infusion therapy? If you have any problems at all or cannot remember the right steps, do not be afraid to ask for help. The packet that your nurses give you has phone numbers to call. Please call at any time. Now, some important tips about caring for your IV. You should remember to flush your IV line every day, including both lumen, if it has more than 1 lumen to the IV line. Be sure to care for your IV line very carefully when bathing. There is a video about how to do this, and you should watch it. Keep the IV line wrapped around your arm or in a sock or mesh when you are not using it. This will make it less likely that the line could get pulled out. Wash your hands frequently whenever you are going to be hanging the IV line or your medications, before and after cooking, before and after eating, whenever they are soiled, and after using the restroom. Soap and warm water are best. Be sure to wash for at least 20 seconds. Hand sanitizer is also a good option. Be sure to rub your hands together vigorously for at least 20 seconds when using either soap and water, or hand gel, or hand hygiene. If your treatment team has asked you to wear gloves, or provided you with gloves, Place them on after washing your hands. Wash your hands after removing your gloves. It is very important when you have a venous access device or VAD to minimize your exposure to infectious organisms. If you have pets, it is a good idea to ask others to help you care for them by cleaning up their waste for you. Certain activities such as scooping dog feces, cleaning cat litter boxes or animal cages, gardening or digging in soil, cleaning toilets or dirty bathrooms, and preparing raw meats may expose you to unnecessary risk while you have a VAD. Ask others to help you during this time to stay safe. When your therapy is finished, talk to your doctor about whether you still need your IV line. If you no longer need it, the safest thing is to have it removed. By following these steps, as well as the specific instructions for the medication, fluids, or IV hydration you will be getting, you can successfully get IV therapy in the home.